Now, the latest on coronavirus today, there have been over 26,000 cases in the U.S. More than 340 people are now dead. More than 311,000 cases and 13,000 deaths worldwide. The State Department has raised its global travel advisory to a level 4. That is the agency's top warning level. It is recommending that U.S. citizens remain in place or return home. And then this weekend, at least 8 states with guidelines to stay home. Joining me right now is the Acting Secretary of Homeland Security, Chad Wolf. Secretary, thanks very much for being here.
It's good to be with you this morning.
So let's get to the very latest. The U.S. closing its border with Mexico, closing the Canadian border effective this weekend. Is the president considering a full shutdown of the country for a period of time, sir?
Not at this time. The president, again, through the vice president and the task force, has been very aggressive and very forward-leaning in providing a number of guidance, a number of information to the American public. We have the 15 days to slow the spread. So there's a number of measures that we're asking the American public to take. You will see that there's been a number of governors, particularly in New York and California, that have taken the extra step and imposed some additional strict measures. And we certainly agree with those measures. There's going to be certain communities that have widespread community transmission that need to take more aggressive measures than perhaps other communities. So again, we're working with them. We're working with the state and local and the governors to do that. And we continue to encourage them to take those aggressive measures.
So let's talk about those aggressive measures, because I'm in New York and there is a statewide stay-at-home order or guideline beginning Sunday at 8 p.m. California is on lockdown. It feels like it is a shutdown. So, I mean, you're not going to do that across the country, but it's effective enough to do it in large states?
Well, again, I think we're focusing on those states and those localities that, again, have widespread community transmission. So New York, California, Washington, there's other parts of the country that we're seeing cases spike. And so those governors are obviously looking at those numbers closely. They're in touch with the CDC. They're in touch with HHS and the task force. We're sharing that information. And in those localities, in those locations like New York City, they're having to take some aggressive measures to slow that spread. There are other parts of the country, perhaps in the Midwest and the South, that are not seeing those same numbers. They don't need to take those aggressive measures at this time. But again, we continue to evaluate this really on a day-by-day, week-by-week basis.
It's like when you and I were talking on the phone this weekend and you said, look, if we shut down New York and California, maybe you don't have to shut down, for example, Nebraska. Maybe that's a chip that you use later on. Is that the thinking?
That's exactly right. What we want to do is we want to take aggressive steps, again, in those communities that we're seeing large numbers and outbreaks so that we don't have to take those measures elsewhere if we don't need to. That's really the concept behind it. But again, I would say that there are measures that the entire American public can take, regardless of where you're at. It's the 15 days to slow the spread that the vice president came out, the task force came out with. So there's a number of recommendations that any American can take anywhere they live. Those individuals that are in, again, high transmission areas like New York City, like parts of California, the governor is asking them to take additional measures so that, again, that we can control the spread and mitigate that.
Tell me, Secretary, about the CDC changes, what we heard this weekend from the Centers of Disease Control, and why that's important. I want our audience to better understand what was significant about the CDC's new regulations this weekend.
So on Friday, the CDC gave an order to the Department of Homeland Security that said to suspend the entry of any individuals coming into the country without proper documentation. And that's important for a couple of different reasons. One, without that documentation, we see individuals coming into the country without proper identity documents, without travel documents, without medical history. And so it's very hard to make a public health determination on those individuals. They were also very concerned, the CDC was also very concerned about when we take those individuals into custody and we put them in Border Patrol facilities and our ICE detention facilities, what type of public health concerns and issues that raises. And so it raises a number of those issues, serious danger to not only other aliens, but certainly the DHS workforce and the American people at large. And so the CDC said we need to suspend that. So that's what the department has been doing over the last 24 hours, and I would say that it's working. We've seen almost a 50% drop in illegal apprehensions, those illegal individuals coming across our borders.
And this is important because it's not just air borders that you're now focused on, but it's land borders, right?
That's exactly right. So we put in measures from 30 different countries, travel restrictions the president did, very aggressive, very forward-leaning early on in this process back in early February. We have travel restrictions from 30 different countries. Those are individuals coming into our airports. But we also need to look at land ports of entry and maritime ports of entry, and we are doing that. So again, also announced on Friday is limiting essential travel across our land ports of entry, both with Canada and Mexico. So now what we're asking is non-essential travel, individuals coming across the border for tourism, for recreational services. If you want to go to your local favorite restaurant, we're asking you not to do that. What we're trying to do is we're trying not to close the border. We're trying to keep the border open. And so we're trying to put measures in place so that we can keep that legitimate trade and travel continue to flow across both Canada and the Mexican borders. What we see every day, it's about $1.7 billion in trade and commerce that flow across the U.S.-Canadian border, and that's every day, about $1.5 billion for Mexico every single day. We want to make sure that we continue that trade. We want to keep the supply chains open, keep the economy running, but we need to take measures now to limit that essential travel, to limit the introduction and spread of the virus.
Yeah, which leads me to the issue of rethinking the coronavirus strategy. No doubt you saw the op-ed in the Journal last week, which is questioning this strategy because it is putting our economy to a standstill. I'm going to get to that in a moment. I've got to ask you about domestic travel. A lot of people are wondering. They see reports that the president is considering shutting down all domestic travel for 30 days. Is that in the cards?
Well, I would say that the task force, we continue to look at it. There's no immediate plans to put travel restrictions on domestic travel. We continue to be concerned, again, about those high transmission areas like New York, like parts of California and Washington. So we're going to continue to look at that. If we see that we need to put some targeted travel restrictions in place, we will do that. But I will say there's no immediate plans as of right now for any widespread travel restrictions.
Because if we look at the timeline in terms of the timeline of border closings, I mean, this has been pretty consistent in terms of closing activity. So what is the threat here? How worried are you that we're going to see a shutdown of the U.S. economy already? Most people are expecting a recession. Some people are talking about even worse than that. What's the thinking around all of these shutdowns and its impact on a $20 trillion economy?
Well, again, the discussions that we have in the task force certainly consider the economy and what we're doing on that. But first and foremost, we need to protect the American people from the virus. So that's first, and that's really what we look at. And so the travel restrictions that the president put in place go to just that. And we continue to look at countries around the world, look at their the number of cases they have to see if additional travel restrictions need to be put in place. So one is a containment or mitigation strategy, making sure that we don't continue to import the virus into the U.S. and we try to protect the American public here. But then, of course, there's already transmission here in the U.S. So what are the measures that we're putting in place here domestically? And there's a variety of measures. A task force announces measures every single day to do that. And so it's a two-pronged strategy, a two-pronged approach here. And so the measures that we're taking at the border from the Department of Homeland Security's perspective is making sure that we're, again, letting that trade and commerce flow. We got to keep the economy moving. We realize that. The easiest thing for us to do is to shut down our borders completely, let no one in. We realize we can't do that. The American economy will not survive that. So we want to make sure that we put thoughtful restrictions in place to keep that cargo, to keep that trade moving.
And I know you're walking this balance really quick. We only have a couple of seconds here. You wanted to mention this disinformation campaign, which continues. We know there's a disinformation campaign coming out of China, but when people see reports, it may very well be cyber fraud, right?
Absolutely. We've seen a number of reports, and I've personally gotten contacted a number of times about text messages or these screenshots going around saying that I know someone at DHS, and they say we're going to have a national lockdown or a national quarantine. And I would just say that's absolutely false. It's not true, and it is part of a disinformation campaign. And what we know, whether it's Russia or whether it's other cyber actors, they like to sow discord on any controversial issue. So it doesn't just have to be elections. It can be any issue. And we're seeing that now with the coronavirus. And so what I would say to the American people is don't believe it. Don't pass it along, and get your information from trusted sources such as your state officials and your federal officials.
And you're going to have enough data by middle of April, end of April, to figure out if this is working, right? You're going to have enough data to understand whether or not the moves you've taken have actually been successful.
Well, certainly the doctors on the task force, CDC, HHS, and the like are really tracking that day by day. What I will say is some of the measures that we are putting in place, some of the aggressive measures that we're putting in place, we need to put those in place now to see results in 3 to 4 to 5 weeks from now. And so, again, they may be uncomfortable measures that you see in New York City, that you see in California and elsewhere, but we're doing that in conjunction with those governors so that we can see results in that 3, 4, and 5 week period out. And so I think we will see some numbers in April sometime to know if the measures that we're putting in place are working.
Secretary, it's good to see you this morning. Thanks very much for updating us.
Thank you.
Today.